Preventable diseases like polio, measles, diphtheria, malaria, etc. are the main causes of high mortality rates, especially in Nigerian rural communities. The Millennium Development Goals were conceived and agreed upon by 189 member states of the United Nations at the UN Millennium Summit in September 2000, where they pledged to make concerted efforts to achieve set goals before 2015. 3 of the goals are dedicated to health care. The FCT administration has been striving to bring healthcare closer to the people. To achieve this, the FCT MDGs office brainstormed and came up with the Meilafia program, in which doctors, nurses, laboratory scientists visit different communities thrice weekly in 6 area councils of the FCT towards achieving a reduction in child mortality, improve maternal health, and combat HIV and AIDS, malaria, and other diseases. Also, the FCT MDGs office came up with designs of primary healthcare clinics to enable clusters of communities have one clinic within 5-kilometer radius, providing access to medical treatment. The FCT MDGs is building a total of 30 primary healthcare centers across the 6 area councils. The projects were kicked off in the 2009 MDGs season. 12 clinics representing 2 per area council for the 2009 season and 18 clinics representing 3 per area council in the 2010 intervention season.
We have so many plans for our existing primary health care centers. Already in 2012 that we are going to implement now, we have approvals to provide the fence gate house to about 16 of them. Because issue of security has been raised severally, and approval has been granted by the national MDGs, and we're going to provide fence and gate house to 16 of these primary health care centers. And then under the local government track too, some of them have been selected. We're going to provide fence and even water to some of these primary health care centers. Then under the same 2012 we're implementing now, some of them have been selected for rehabilitations, some primary health care centers. We're going to improve them by rehabilitating them, providing them with the necessary structures so that they become attractive. We also have approval to do 3 this year under the 2012 program. So we're going to do additional primary health care center, 3 of them, located in 3 different area councils.
There are project coordinators for each area council. One of them is architect Ramalan Ahmed. He is in charge of monitoring and evaluation of all FCT MDGs projects in Abaji Area Council. Some of the projects undertaken by the FCT MDGs office in Abaji Area Council since 2007 include the construction of 40 prototype toilets for primary schools and over 40 solar-powered boreholes for various schools and communities. In 2008, about 12 solar-powered boreholes were completed, while only 1 prototype toilet and water supply was completed for a primary school. 2 community boreholes were completed in 2009. Architect Ramalan is here with his team to inspect the primary healthcare center constructed last year for Adagba community in Abaji Area Council. They set out to scrutinize every detail of the project.
What we have done here in Adagba, we provided a primary healthcare clinic and a staff quarters. This is a 2010 project, an intervention project, and the work commenced here in 2011 and it was concluded in 2011. We are here today to exit the project, that is to check the retention, the defects, so the contractor will now effect repairs, and then he exit the project, will now take over formally, and we start now arranging or preparing for maintenance as the need may arise. In every new structure, you expect that within the span of 6 months after its initial construction, there will be a lot of settlement because you have imposed new load to the ground. There will be a lot of shrinking and of materials in form of the wood. There is expectation that some errors in construction will be committed. So after 6 months, we are here to confirm and check those defects. And immediately we confirm them, we'll now ask contractor to make good those defects, so that as he is exiting, he will leave the structure close to 100% efficiency. Then from there, we know as life, like human being, buildings depreciate. And now we now put them into our maintenance, regular maintenance schedule and see how we'll be attending to the defect from time to time.
And we're also looking at areas that we have dilapidated structures, because we have a schedule of dilapidation submitted by the different area councils, and we're looking at it, and based on our budgets on the ground, these are the areas we intend to do their repairs so that they become interesting and can attract some of our patients to these clinics.
Bringing healthcare closer to the people is the overall purpose of constructing 30 primary healthcare centers spread across the 6 area councils of the FCT. Most importantly, however, the medical personnel that will man these clinics have been put into consideration through the provision of a block of twin one-bedroom semi-detached flats behind each clinic to house the doctors and nurses and ensure the beneficiaries of the FCT MDGs healthcare initiative get medical attention round the clock. The provision of these primary healthcare centers in all the area councils is targeted at strengthening the achievements derived from the Melafia program, in which doctors, nurses and laboratory scientists visit different communities thrice weekly. Patients seen by the Melafia team could be referred to the clinics for more adequate health care. Sule Dennis is the nurse in charge at the Adagba Primary Healthcare Center. He has been a qualified nurse for about 20 years now and started working here when the clinic was opened in July last year. So far, they have attended to more than 200 patients, treating them for malaria fever, providing antenatal services, and more.
The attendance of this clinic since we started is up to 246 patients now. And we treated mostly the commonest treatment we do here is malaria, which is very rampant. We treat malaria, we treat typhoid, we treat sexually transmitted infections, we take delivery, we attended to antenatal, which their figure now mounted to 38 patients now. And we also do routine immunization. We do immunization for Ward 1, which covered even not only here in Adagba, but our ward like Yaba. Yes, we do children 0 to 59 months. We give them the antenatal cases, we give them TT, that is tetanus toxoid. We give it to up to the date of delivery. And we also treated typhoid cases.
From the records of the clinic, this hospital started operation in July of 2012. And in between that time and now, they have attended to about over 240 patients, out of which 38 of them are on antenatal. But for the general patient attendance, over 240 patients have been attended to. And this clinic covers areas like Lafia Yaba, Tekpeshe, Gurdi, Rugan Fulani, and a host of other communities that are within this vicinity. They all attend this PHC, in which before this time, there was no facility like this around this area. They all moved to Abaji, Yaba and Abaji.
Wasila Safianu is 15 years old. She is here today to register for antenatal service.
I am here because I want to be sure I am pregnant. I have never been to the hospital. We only go to the pharmacy for treatment. Now that this hospital is here, I am happy and will be coming.
Godwin Yebo is from Bayelsa. He came to this community more than 15 years ago and is glad that finally he used the services of a clinic in the community a few weeks ago.
I came from Bayelsa State. I'm a businessman in Adagba community. I'm the chief of the Ijon community in Adagba. There is a time that I have malaria. I went to the clinic. The doctor done a lot for me. Immediately he tested me and gave me all the tablets, inject me. The following 2 days, the malaria goes. The community women, they are going there and deliver many sickness, both malaria, those children and other neighboring villages. They are coming here.
They really love this clinic. Why I say they love this clinic is they are really patronizing, they are bringing problems to us, and we are definitely solving their problems. And most of the times, they will just come and sit with us and tell us that really, as this clinic was here now, they are very happy. Because even in the late night, when they are sick, they will come and get somebody and their problem will be solved. Like some of them will just come and sit with us. These are the evidence that shows that they really love this place. And we are giving their children immunization. So it's one of the reasons that they really love it. Because even when we announce it that yes, we are going to do immunization today, their parents will now send all their children here to come and take immunization. So it's indication, one of the indications that yes, they really love this clinic.
In my own view, this project has impacted heavily on this community by bringing health facility very close to the community. By going through their records, you see how far and near communities around this catchment area all attend this clinic. They will have been moving either to Abaji or Gwagwalada in order to get health facility. But now they have, with the presence of this PAC in Adagwa, we have brought in very close to them health facility.
The FCT MDGs office is looking to addressing issues of malnutrition among under 5 children in the health intervention program for this year.
Part of the health intervention in the rural communities, the nutritional status of under 5 children is part of the program we're going to do. There is a proposal we submitted to national MDGs and they have approval. We are trying to look at nutritional status of under 5 because we believe these are areas that we should also begin to look at the issue of nutrition among the under 5, and we have had that approvals, and based on our indices, we have selected 30 wards of the FCT where we have this prevalence. We're going to intervene. So there's a program for the under 5 under the nutrition that we'll do this year, just to ensure that those health indices of goals 4, 5, and 6 are achieved in the FCT.
Also, the 2008 baseline survey and current trends in existing primary healthcare centers reveals that malaria is prevalent in rural communities of the FCT. Now, the FCT MDGs office plans to reverse that trend this year.
Malaria has been the highest number of cases being reported in the various primary healthcare centers. So already the health desk is looking at ways of trying to intervene because we believe the nets, we have distributed so many nets before, but for the past 2 years we have not distributed. So we are trying to look at it and see the possibility of bringing it back so that it will, because the issue of malaria has really been our biggest challenge now. From all the statistics we have, malaria has topped the number of diseases reported in almost all the primary healthcare centers we have, including the mobile health team. The same malaria cases have been reported. So the health desk is also considering that and will be part of our submission for 2013.
As the target date for the achievement of the Millennium Development Goals draws closer, more clinics will be constructed. The target is that by the end of 2013, the Federal Capital Territory should have established 62 PHCs in the 6 area councils. That is, 1 PHC in each of the 62 wards in the FCT, fully equipped with a block of semi-detached 1-bedroom apartments for medical personnel, a standalone solar-powered equipment to power the clinic and staff quarters, and pump water from the borehole provided for use. In a bid to ensure prompt and adequate monitoring of FCT MDGs projects in rural communities across the 6 area councils, the project support unit turned to modern-day technology by using Google Earth. This initiative also promotes transparency by making every project site accessible to interested members of the public. The FCT Minister, Senator Bala Mohammed, believes the FCT MDGs project tracking online tool is a very useful platform in collating projects across the different area councils of the region. The FCT MDGs project tracking online tool helps in providing the right platform to aggregate all awarded projects by the MDGs Project Support Unit, thereby presenting a directory of all projects sorted alphabetically by communities, wards and area councils for easy searching. The FCT MDGs Project Support Unit collaborated with the FCTA Department of Economic Planning, Research and Statistics to integrate the Google Mapping layout onto the Project Tracker web portal. You too can view FCT MDGs projects on Google or go to www.fctmdgprojecttracker.org. In the broader community of Gurdi, FCT MDGs project supervisors stopped over to have a look at the ongoing construction of a police post. The project is financed by the FCT UNDAF 2 office for the FCT Security Services Department and designed, cost and supervised by FCT MDGs office.
This is one of the 12 police posts initiated by Security Department of FCT Administration. It's being financed by FCT UNDAF 2. The project was fully designed, costed, and monitored by FCT MDG Project Support Unit. Here we are in Gurdi community of Abaji Area Council. The police post is a prototype police post, 2 in each of the 6 area councils.
Bringing these projects to rural communities comes with a lot of challenges, including vandalism, rough terrain, and more.
The challenges we have been facing, especially in the project unit, is issue of terrain, that we cannot operate throughout there. So there are times that because of the location of this project, we can't access such places until at a particular season or month of there. So we now, and this will lead to delay in delivery because it affects our efficiency and our activities generally.
Basically, some of our challenges is the issue of terrain, and you can see from the visit you had to Adagba, it's not easy. The terrain is bad, and you have to go a long distance to get across these communities. But the area councils, we've been talking to them, and assurances are coming from them that some of these rural routes, they will rehabilitate them. Then we have the issue of personnel, which is really a big challenge for us. But the National MDGs has actually approved, we engaged volunteers, and that's what we're doing. Even under the local government track, there's a provision for us to engage volunteers. We pay them some allowances so that they can man these primary health care for us, centers for us, because this is one of the areas that has been of great concern to us. If you have the structures without the personnel, certainly service will not be provided. So as we are doing the centers, we're also looking at the volunteers that we engage before they are recruited permanently into these primary health care centers.
Join us next week as we check on beneficiaries of the Conditional Cash Transfer Scheme.
The CCT program is aimed to help the poor amongst us, so to enable their children go to school. They are entitled to a certain stipend on a monthly basis, depending on the number of children they have. So we are here for the sensitization and selection of the beneficiaries.
I'm happy the government didn't left us out. With this program, my community benefited on it. So I thank you.
This is an MDG program from federal government. And from what I know from this program is that it's designed for vulnerable people that have physical problems, challenges, which did not enable their world to go to school. Federal government want to help them so that from this looking token, these children can able to Some of them have these physical challenges that they cannot be able to eat in their various houses. That is why the federal government designed this program to say, okay, these people that are suffering this kind of environment, let's help them.